Hi viewers, in this series of videos we'll be discussing about pharmacology according to INC syllabus basis. So in this video we will talk about unit 1 which covers the definition, sources of drugs, lot of terminologies, pharmacodynamics, pharmacokinetics, routes of administration, legal issues and rational use of the drugs. And at the end of this video we'll be discussing university point of questions as well. Come on, well, let us start the definition. So you all know that pharmacology, the meaning, if we see, it derived from a Greek word called pharmaco and logy, that means study about drug. Pharmacology is all about study of drug, its effect to the body and the body's response to the drug. So what is pharmacology? It is all about the study of drug, that includes drugs' effect to the body and the body's response to the drug. What is pharmacodynamics? So if we see closer view of this, dynamics means any change happens, we say it as dynamics. So what is pharmacodynamics? It is what the drug do to the body. What is the changes happens to the body after administering a drug. Okay, it includes the mechanism of action which we expect from each drug, but there are undesirable effects which is not expected, like side effects, adverse effects or toxic effects. So the pharmacodynamics studies about the drug's desirable effects and undesirable effects. So which includes the desirable effect is mechanism of action, and the undesirable effect includes side effects and adverse effects and toxic effects. Side effects is minimal effects which you get from the drug, and adverse effects are a little worsening of the side effects, and toxic effects are really toxic when you take the drug in a large amount. So when you talk about a drug's action and effects, then we say it as pharmacodynamics. What is pharmacokinetics? So you can have a closer look here. What is the body's response to the drug? What the body does to the drug, which is called pharmacokinetics. How the drug is moving in our system. Okay. The main mnemonics we use here is ADME, that is absorption, distribution, metabolism, elimination or excretion. So A is absorption, D is distribution, M is metabolism and E is elimination or excretion. So this ADME happens to every single drug, but majority of the drug is absorbed in the GI tract if it is taken orally. And if it is given IV, directly absorption happens in the blood. And what is the distribution? Distribution to all the areas which is needed. So the drug is carried and distributed through the blood to all the area or wherever it is necessary. And this metabolism or biotransformation of each drug or majority of the drug happens in the liver. That's why whenever we take a higher dose or any drug or misuse of any will leads to liver damage. So metabolism is carried out by the liver, and the excretion of the drug happens in different ways, most of them through the kidney, but the excretion or elimination of a drug happens through urine, stool, saliva, air, the expiration what we expel out, all through that also the drug can come out, milk secretion in a lactating mother. So elimination happens in different ways, but most of them is through kidney as a urine, and the rest of the some of the drugs may come out through stool, saliva, air, milk, even some very minimal amount comes out through the sweat. So what the body does to the drug, we say it as pharmacokinetics. Pharmacokinetic is a mnemonics where you can say ADME. A is absorption, D is distribution, M is metabolism and E is elimination or excretion. Sources of drug. So where we get drug? You all know, if we go through a history of pharmacology, we know that Ayurveda was the very important role. So Ayurveda is nothing but you use plant as a medicine. So the main source of drug is plants, and in some areas the best example for plant medicine is digitalis plant, where that flower is used for producing digoxin. The next one is animals. Animals are used as a source of drugs, especially in case of insulin. The pancreas of the sheep is, or the cow, pig, all were used as a insulin production. And the cod liver oil, we get it from the fish, and even anti-venous serum, we get it from the horse. So there are a lot of sources or drugs are produced through animals. The next one is minerals. The existing normal minerals like iron, zinc, gold, chloride, everything used as a normal mineral supplements. The next one is microbes. Microbes like penicillin, lactobacillus, streptomycin, these are all the drugs which is produced from the microbes itself. Microbes are nothing but microorganisms. The next one is synthetic. So we produce lot of synthetic drugs. There are a lot of examples you can write, like all the emetic drugs, bismuth iodide, all are synthetic drugs. There is a biotechnology which is recently advanced in the production of drug. They are like DNA technology, which we are using, nanotechnologies. We use it to produce a drug or in the treatment. So even now for the corona, we are using a biotech drugs which are derived from a DNA technology inside the lab. So these are all the sources of drugs: plants, animals, minerals, microbes, synthetic drugs, and biotechs. The next is factors affecting drug action. So when you take a drug, it depends upon the persons, and there are a lot of factors which affects the action of the drug. The very important thing is age. So as per the age, you have to produce or give the drugs or administer the drugs, because the action makes it different. Sex. Some of the drugs may act in a different way in female and male. Body weight. So it depends upon the person's weight and the strength, the effect of the drug works. The route. This is a very important one, where if you take it orally, how the drug is effective, or if it is given IV or subcutaneous or any other parenteral way. So the effect of the drug is different. Time of administration. Some of the drugs, especially the hormones, when you prescribe, you have to mention when they should take it. For example, like thyroxine should be taken early morning, or if it is a warfarin, it is better to be given in the evening. So the time of administration of medication is also makes an effect in the drug's action. There are physiological factors and psychological factors which plays a role in the drug action. The physiological factors like body temperature, acid-base status, that is also changes the drug's action. Psychological factor, of course, it is very effective and beneficial. When you are giving any medicine, the patient should accept and take it. Pathological status, sometimes if the patient has any other diseases which may interfere with the drug's action, that also you should see. Genetic factors, tolerance of the drug from the patient, and drug interaction, drug to drug interaction. So all these things makes a lot of effect in the drug's action. So whenever you give any drug, you should think of all these things and administer. So age, sex, body weight, route of administration, time of administration, physiological, psychological, and pathological factors, genetic factors, the tolerance of the drug to the patient, and drug to drug interaction. Routes of administration. I'm not going in detail about this because I'm sure that you have studied in nursing foundation what are the different types of routes of medication administration. There are like parenteral route, enteral route, and local routes. Local or topical. enteral or oral, sublingual and rectal, and parenteral or inhalational injections, and in transdermal. So injections are of different types: intramuscular, intravenous, intradermal and subcutaneous. So these are all the different routes of administration. It's a very important aspect where they ask questions when they want to you should know the difference happens when you take it orally or when you take it in parenterally. So that is an important aspect here. So you all should study that what are all the different routes of administration, especially the side effects and the advantages. Different routes of elimination. The drug is eliminated, as when we discussed in the elimination during pharmacokinetics, we have seen that where and all it is eliminated. So here renal plays a very important role. Almost 70 to 80% of the drug is eliminated through urine. Pulmonary, that is through expiration air, it is eliminated. The best example is like those who have taken alcohol, drank alcohol. When they come closer, when they breathe out their air, we can get the smell. So which is exact example of drug elimination. Hepatic and biliary, through hepatic and biliary tract also very minimal amount of drug is eliminated. Fecal, mostly erythromycin and tetracycline are eliminated through fecal content. Breast milks, some of the drugs are eliminated in the breast milks, that's why it is not given for the lactating mothers, like tetracycline, anti-asthmatics, anti-epileptics, all the anti-cancer drugs. All these drugs are eliminated very minimal amount in breast milk also. Sweat, sometimes sweat also the drug is eliminated, like sodium chloride and low amount of drugs, very minimal amount of drugs excreted through the sweat. Saliva, especially nicotine and metronidazole, you can see it more in saliva. Nails and hair, like some of the minerals like arsenic, lead, all these things comes out through the nails and hair. So these are all the different routes of drug elimination. The next is rational use of drugs. So when you use a drug clinically, how you should use it, that principle we say it as rational use of the drug. So whenever you give a drug, you should make sure it is written by the doctor and as per the patient's condition and the diagnosis. So proper diagnosis should be made before prescribing or giving or administering the drug. Proper decision is essential by looking at the patient's condition, clinical conditions like signs and symptoms and the other diagnostic tests. And proper selection of drug is essential. Whenever you select a drug, you just look for the patient's benefit and the cost effectiveness. The money is very, very essential thing. Whether the patient can able to take it longer time, especially because we are getting newer drugs every minute. Okay, and if the patient cannot afford it, he cannot take it for a long run. So you should prescribe a drug which is possible for the patient to take it in a long run. Okay, proper selection of drug which includes proper combination, right route, easy availability, essentialness and cost effectiveness. These are very, very important. The next is right dose. So there are rights which we will discuss in the next slides. Okay, you should follow all the 10 rights and the status of the patient should be monitored. So if you are not following any of these things, we say it as irrational use of the drugs, where you put your discipline under risk. So you should, whenever you use a drug or administer a drug, you should use it rationally. Next is first pass metabolism. It is a terminology comes in the first unit. So in the metabolism of pharmacokinetics. So what happens here? It is the metabolism that occur after absorption and before it reaches the circulation. So during this time, what is happening with the drug? We say it is first metabolism. So where it happens is after absorption and then before reaching the systemic circulation. Okay, so what is happening especially in the liver? We say it is during this time After absorption and before going into the blood, what is happening? We say it is first pass metabolism. It reduces the bioavailability. For example, when it is taken orally, what happens? It is absorbed in the GI tract and it goes to the liver and it gets metabolized and comes back to the blood. Metabolized drug is for absorption, it goes to the blood for distribution. So during this time, how long it takes? We say it is bioavailability. So if the first pass metabolism is lengthened, what happens? The bioavailability reduces. Routes which avoid first pass metabolism are IV, sublingual and perrectal. So when you administer any drug through rectally or intravenously and sublingually, the first pass metabolism is avoided. So the effectiveness of the drug is very quick. The bioavailability is very good. So you should remember that when you administer a drug sublingually or rectally or direct IV, what happens? The effectiveness of the drug is very, very instant. The next is bioavailability. So what is the bioavailability? The rate and extent of the drug absorbed from its dosage form. For example, when you give 100 milligram of a drug, how much it is absorbed and become effective. Okay, we say it as bioavailability. It is defined as the fraction of unchanged drug that reaches the systemic circulation in the intact form irrespective of the route of administration. So irrespective of the route, the fraction of the unchanged drug that reaches the systemic circulation. So after this ADM, how much of the drug is distributed to the part? For example, when you take a drug, you want this drug to go to the lungs. Okay, and you are giving 100 milligram of the drug. After the absorption, metabolism and distribution, when it reaches the lungs, how much it is effective? We say it as bioavailability. Like how much amount of the drug reaches the lungs at the end of absorption, this metabolism and distribution, we say it as bioavailability. Higher the bioavailability of the drug, longer will be the duration of action. So if the bioavailability of the drug is more, the duration of the action is longer. There are factors which affects this bioavailability, which are solubility of the drug, chemical formulation and stability of the drug. Some of the drugs are very unstable. So if it is not given IV or sublingual, it won't be very effective. First pass metabolism after oral dosing. So how long it takes from the oral cavity to the blood. That is also have a effect on the bioavailability. Route of administration, orally taken drugs has a less bioavailability comparing to the intravenous or sublingual. Blood flow at the site of administration, how much of blood circulation is present at the site of administration also plays an important role. Concentration of the drugs and pH of the surrounding area. So these are all the factors which affects the bioavailability. So when you give any drugs, you should remember that if the patient has severe pain, so if you give a oral drug, it will take a lot of time and the effect will be very less because of the first pass metabolism. Whereas when you give it an IV bolus or a rectal, per rectal, it is very effective so that it gets absorbed easily. Because when you give sublingual, the blood flow in the area under the tongue is very high. So it is easily absorbed directly into the blood. So you should remember the factors which may affect the bioavailability. Simultaneously, it will affect the effectiveness of the drug's action. The next is biotransformation. Biotransformation is nothing but the metabolism of the drug. So when they ask biotransformation, don't get confused. It is the same metabolism we discussed in the pharmacokinetics. It is a process of biochemical alteration of the drug in the body. So what is the chemical changes happens with the drug in the body? We say it is biotransformation. Body treats the drug as a foreign body and tries to eliminate it from the body. So whenever something comes inside, what happens? The body will think it as a foreign body and tries to eliminate it from the body. So it metabolizes the drug. Site where and all the metabolism or biotransformation happens when you take a drug orally. It reaches the liver. Majority of the drug goes to the liver for biotransformation or metabolism, and some of them goes to kidney, intestinal mucosa, lungs, blood, and some it happens in the skin, especially when you apply it locally, local creams. Okay, so these are all the areas where biotransformation happens. Majority of the drug goes to liver, kidney, gut mucosa, that is intestinal mucosa, lungs, blood, and skin. What is the result happens is inactive form is converted into active form, or sometimes active form is converted into an inactive form. So what happens at the end of biotransformation is an inactive drug is converted into active. Enzymes used in, there are a lot of enzymes which are used in the biotransformation. According to the place where it is acting, according to the enzymes are used for the biotransformation. So without enzymes, metabolism will not happen. So biotransformation is nothing but our metabolism which is happening with the drug during pharmacokinetics. So it is nothing but biochemical alteration of the drug. Body treats the drug as a foreign body and it will start metabolize it and eliminate it. So metabolism happens in liver, kidney, intestinal mucosa, lungs, blood, and also in skin. So what is the end result of this metabolism is inactive form is converted into active form, or in some cases it is active form is converted into an inactive form with the help of enzymes. Okay, there are different terminologies which may be asked in your 2-mark question or answer briefly. Okay, these are all the important terminologies which is frequently asked in your question papers. Drug. What is the definition of the drug? What is prodrug? Prodrug is nothing but an inactive form of the drug which is taken into the body and it is converted into an active form. What is therapeutic index? What is therapeutic window? Therapeutic drug monitoring. Adverse effects, toxic effects, what is the difference? Drug synergism and antagonism. Some of the drug will become, when it is given with one drug, the action of both the drugs will be very effective. And some of the drugs which is given combination with the other drug, the effect will be less. That is called drug antagonism. Drug synergism, the drug's effect will be more, and in drug antagonism the drug's effect will be less. Drug dependency, drug tolerance, what is receptor and what is teratogenicity. Teratogenicity is nothing but the drug will pass through the placental barrier, which there are some drugs which passes through placental barrier which may give an effect in the fetus also. We say it as teratogenicity. So these are all some of the terminologies you should focus on this first unit to study, so that they may ask in 2 marks or 3 marks question. The next is legal issues. What are the legal issues as a nurse you should face is while administering the drug to the patient, you should remember all these 10 rights, which is very, very important university questions. These are all the repeated questions. In the bracket, what I have given is these many times repeated: bioavailability, biotransformation, prodrug, intramuscular and intravenous, oral and parenteral, intravenous and subcutaneous. These are all frequently asked difference between. So you should remember that when you study the routes and administration, you should study like this, so that mostly they have asked in the difference between. What is drug? Drug tolerance, teratogenicity, adverse effects of the drugs. Twice it is asked. Pharmacodynamics, pharmacokinetics, drug synergism, drug dependence. So these are all the frequently asked important university questions you should focus on when you study Unit 1. Hope you understood the Unit 1. So along with this video, just go through your unit and try to finish the unit. Thank you.